I'm going to kind of couple these two together. So first you want to start with inspection, just looking for any sort of redness, joint symmetry, nodules, inflammation or swelling, any sort of abnormalities on the hands or the wrists anywhere. And you're going to be doing that with inspection all over the body as we go. So I don't see anything. So first I'm going to start to palpate. I'm going to be doing the distal and the proximal interphalangeal joints, checking for any swelling or nodules, discomfort at all, and then also the metacarpal phalangeal joints as well. Then you can also palpate the different metacarpal bones and the carpal bones in the wrist. So go through all the while checking for symmetry or any sort of pain or tenderness, warmth, swelling, fluid, sacs or anything like that. So next thing I'm going to do is I'm going to do some range of motion. So I'm going to have you extend your fingers, and then I'll do it for you as well. So we're going to be doing, passive and active range of motion, which means I'm going to have him do it, and then I'm going to do it also. And now curl your fingers to, that was extension we did before. This is flexion. And now we're going to go ahead and do the wrist. So now extend your wrists up, and then flex them down. Perfect. And then I'll do it for you. And then I'm going to have you what's called abduct your wrists and adduct your wrists. Okay, now just relax and I'll do it for you. Just checking for any crepitus. Anytime we do range of motion, you want to check for any crepitus or any sort of popping or abnormal noises, sounds, feelings, anything like that. So that all looks good. Next thing I'm going to do is just a couple specialty tests for the wrist. So the first one is called Tinel sign. So what I'm going to do is I'm going to hyperextend this wrist. I'm just going to tap on your wrist. Any pain or tenderness there? Okay. So this is checking for carpal tunnel. The next one I'm going to do is called phalanx test. So go ahead and kind of put your hands in prayer position. Perfect. You can do it like this, or you can also do it like this. Normally we'd have you do it for a whole minute. See if you have any numbness, tingling, or pain in your hands. That basically that band times across your wrists, and that can aggravate any sort of carpal tunnel syndrome. So that looks good. We're going to move on to the elbows next. So I'm just going to look at your elbows. Look again for joint symmetry, redness, swelling, inflammation, nodules, and anything like that. And that all looks good. So now I'm going to go ahead and palpate. I'm going to feel for the olecranon right here, just the tip of the elbow. So you can just sit kind of like this. Yep. Just feel the tip of the elbow, the lateral condyles, the medial condyles right here, or epicondyles. If there is pain, do you have any pain or tenderness? Okay. If there is any pain or tenderness on the medial side, on the epicondyles, that can be medial epicondylitis or golfer's elbow or baseball elbow. And then on the lateral side, same thing, lateral epicondylitis, and that will be tennis elbow. Next thing we're going to do is, and then I'm also going to palpate for the extensor surface of the ulna right here. Okay, so next we're going to do some range of motion. So first I'm going to have you flex your arms and now extend them. And then with your arms out, you're in supine position. Now pronate, supinate, pronate. Awesome. And then I'm going to actually do that again for you. Just making sure we've got really, really good passive and active range of motion. That looks really good. So that's everything for the elbow. Next we're going to move on to the shoulders. Normally you'd want to be able to see your patient's skin. For this video we're just going to have Shane keep his shirt on for us. So first I'm going to just inspect. You would be inspecting for any redness, again, warmth, swelling, joint symmetry, inflammation, nodules, and then next we're going to palpate. So I usually like to start the sternal notch and then palpate up that clavicular line until you hit that acromioclavicular joint here. So we're going to do that on both sides. Any pain or tenderness? Okay, and then next you can also check for, just below that, you can feel for the coracoid process of the scapula will come through right through there as well. Then just lateral to that, you'll feel the biceps groove in the humerus. And then also you can check for the subdeltoid bursa under here. Any pain or tenderness? Okay, and then also you can feel for the tubercles on the humerus. Okay, so next we're going to do some range of motion. So for this, I'm going to So you're kind of at your sides, go ahead and it's kind of best if you stand. So let's maybe have you stand up just because this chair doesn't quite help us. So go from this side all the way up, and then, so you're actually up like this, and then I'm gonna have you take one arm and pull it across. Okay, so that's abduction and adduction. Now we're gonna have you do adduction and adduction, there we go. And then the next one we're gonna have you do is flexion and extension. Perfect. And then we're going to have you do external rotation, one arm at a time. Try and really reach back to the middle of your back. And then same other thing. Yep. And then internal rotation is back where you're trying to touch that other scapula. Do you have any pain in your shoulders? And then you can do some of that passive range of motion as well, where you as the provider are doing all those movements as well with them. Just really checking for any limitations in the arms or in the shoulders. So that's everything there. The next thing we're going to do are just a few specialty tests to check for rotator cuff injury. The first one we're going to do is called Hawkins sign. So you're going to flex your arm up, and then you're going to bend at a 90-degree angle. And I'm just going to slightly push down. Do you have any pain right there? Okay, same thing on this side. So you're just checking for any sort of torque in that shoulder if it's painful. Next one you're going to do is called apprehension test. You're going to raise your arm to the square, and then I'm just going to slightly pull back right there too. Any pain? Okay. And then the last one you can do is called, well, there's plenty of them. Another one you can do is a drop sign, where you're going to raise your arm all the way up, just one at a time, and then slowly bring it down. And then if that arm were to just drop, then that would be, like if you were to be going and it just drops down, that could also indicate a rotator cuff injury as well. So that's everything on the shoulders. Next thing we're going to check is the head and the neck. So first I'm going to just stand behind the patient. You can just kind of turn sideways for us. And you can have them sitting, just because we have a couch, we're just going to have them stand. So nice and straight for me, Shane. And then I'm going to place my fingers right in front of his ears, in front of these tragus here. And so go ahead and open and close, and now move your jaw side to side. Okay, and just checking for any popping. Do you have any pain there? Okay, no warmth or anything there. And we're also just, again, inspecting the head and the neck for any sort of asymmetry, redness, swelling, deformities, abnormalities in general. Next thing, just open your mouth as wide as you can, and then the patient should be able to fit, you don't have to do it, but fit 3 fingers vertically into the mouth. You're good. To check for that TMJ inflammation or issues with that joint. Next thing we're going to do is just have you do some range of motion of your neck. Well, first I'm going to palpate. So you can palpate the cervical spine here, just these processes along the spine, and then the paracervical muscles here. Also the trapezius muscles coming into here, and the rhabdoids right here as well. Checking for any sort of warmth, swelling, knots, anything like that. Okay, so next we're going to go ahead and have you do some range of motion. So go ahead and flex your chin down to your chest. Now extend the neck all the way up, and then you're going to do your ears to your shoulders. Checking for lateral. Let's see if you can go a little bit further. Yeah, really testing your ability to flex that neck. Perfect. Next we're going to, and then go ahead and you can also rotate your head like this, side to side. Perfect. Okay, next thing we're going to do is just a specialty test called sinuses. It'll come to me. But this is also called cervical compression test. So you're going to extend the neck just a little bit and turn your head to the affected shoulder if they've got pain there, and push down. Any pain? Okay. Same thing on the other side. Any pain? Okay. And that could be just checking for radiation or of pain down that shoulder, or paresthesia down that shoulder. The next thing we're going to do is just look at the spine. So as you can kind of see, again, you'd want to have the patient, you'd want to be able to see the back the best you can. But we're just looking for that natural S curve in the spine. So as you stand straight with your head nice and straight, you want to see a nice concave right here along the cervix of the neck, and then it will kind of round out here and then back down into that concavity right here and end right here in the sacral area. So next thing we're just going to look at, we're going to look for any sort of deviation of the spine, any lordosis or kyphosis, which I don't see any here. And then you want to check and make sure the shoulders are nice and the same height, the hips are at the same height, and then this sacral junction here is also nice and even. We'll also check that again as the patient flexes the hip down. So next thing we're going to do is just palpate. So I'm starting around C7 and just palpating those spinous processes all the way down. You can also kind of feel in between for the intervertebral spaces. And then if there's any suspected spinal fracture, you can place your hand flat and then using the ulnar surface of your hand, just percuss down that back to see if there's any pain elicited. Any pain? Okay. So that checks for spinal fracture. Next thing we're going to have you do is go ahead and just bend all the way down forward as far as you can, nice and slow. And you should have a nice smooth curve here. This is another way to check for unevenness in the back for scoliosis. And you'll want to check and feel those hips are nice and even again, because you really don't want to see, you want to look to see if any one of your limbs is longer than the other. Okay, you can go ahead and stand back up. So that's flexion. Now go ahead and extend your back. Just lean back, perfect. And then go ahead and go side to side. And then twist, rotate your shoulders. Awesome. Any pain or discomfort there? Okay. So everything looks good there for the spine. One specialty test you can do for the spine is called a straight leg test. It will check for sciatica. We'll do that actually as we're checking the hips and things. But basically they'll raise their leg, and if there's any pain below 45-degree angle, it could show that, because your sciatic nerve runs right through here. And as you extend that leg or straighten that leg up,
start off with your vital signs.
Discomfort there.
And I'm going to start off with your blood pressure. All right, her blood pressure is 120/80. Then I'm going to go ahead and check your pulse. All right, her pulse is 68 beats per minute, and I'm going to go ahead and check your respirations. All right, and she has 18 breaths per minute, and I'm going to check your temperature, and your temperature is 98.6. All right, so I'm going to go ahead and assess your skin first. I see that there is no cracks, lesions, bruising. It's warm to the touch, it's dry, it's pink within normal range. All right, I check that bilaterally. I'm going to check your capillary refill. It's less than 3 seconds. I'm going to check your skin turgor. And there is no tinting. All right, so now I'm going to go ahead and look at your face. It's normal cephalic. Your nose is symmetrical with your face. Your eyes are even symmetrical. Your ears are symmetrical, even. And, all right, great. Can you go ahead and smile for me, frown for me, puff out your cheeks, raise your eyebrows, close your eyes. All right, so cranial nerve number 7 is intact. So I'm going to palpate your frontal sinuses, and I want you to tell me if you feel any sensitivity. No. All right, and there was no swelling. I'm going to palpate your maxillary sinuses, and you tell me if you feel any sensitivity. No. All right, and there was no swelling with that as well. And I'm going to go ahead and palpate your temporal artery. All right, and that is a strong 2+, and I will check that bilaterally. Okay. Wash my hands, put on gloves. All right, so I see that your hair is brown, length, there's no thinning. Your scalp is white. I don't feel any bumps, lesions, masses, breakage, anything abnormal. Remove my gloves. Wash my hands. and have you look behind me. Alright, her pupils are equally round. Her eyes are reactive to light and accommodation. So cranial nerve number 3 is intact. Go ahead and look at the tip of my pen and follow it with your eyes, but not your head. Alright, great. So cranial nerves 3, 4, and 6 is intact. Alright, so I'm going to go ahead and have you pull down your conjunctival sac for me. Alright, so her sclera is white. Her conjunctival sac is pink, moist. There's no lesions. Both of her eyes are symmetrical. Her external structure, they are both equally round, symmetrical. Right, you can let go. Okay. Alright, so your pupil size is 3 millimeters. I would check that bilaterally. Alright, so now I'm going to go ahead and look at your ears. I see that they are even, symmetrical. I'm going to go ahead and look at the external. There's no lesions, breakage, drainage, masses, anything. I would check that bilaterally. I'm going to go behind you and I'm going to whisper a 2-syllable word. I'm going to have you cover up your left ear for me and you repeat the 2-syllable word.
Window.
Alright, great. So cranial nerve number 8 is intact. So now I see that your nose is midline, symmetrical to your face. I'm going to go ahead and look up there. I see your septum is intact. There's no breaking. Your mucosal is pink, moist. Pink, let's see, the size is good. Can you go ahead and cover up? Alright, breathe in and out. Alright, other side. Alright, patency is good on both nostrils. Alright. So now I'm going to have you close your eyes for me. So I want you to tell me what you're smelling.
Alcohol.
Alright, great. So cranial nerve number 1 is intact. Wash my hands. You go ahead and stick out your tongue for me. Or bring it up, down, side to side. Alright, great. So cranial nerve number 12 is intact. Open your mouth up for me. The buccal mucosa is pink, moist, no lesions. Gums, pink, moist, no lesions in the gums. You have 32 teeth, no cracks, no breakage, no decay. Stick your tongue out for me. Your tongue is pink, moist, no lesions. And say ah. Your tonsils are a 2+. Alright. Remove my gloves. Wash my hands. So I see that your tracheal is midline. I see that you have no jugular vein distension, pulsations, anything to be concerned with. Go ahead and swallow. Cranial nerves 9 and 10 is intact. She has good gag reflex. I'm going to go ahead and check your carotid artery. That is a strong 2+. I would check that bilaterally. I would check this side as well. And that is also a strong 2+. Go ahead and put your chin to your chest. Head back, side to side. She has full range of motion in her neck. Go ahead and palpate right here. Tell me if you feel any sensitivity.
No.
Alright, there's no sensitivity, so that's great. I see that she has unlabored breathing. She has a 2-to-1 ratio. Alright, so now I'm going to go ahead and listen to your breath sounds anterior. Alright, 1, 2, 2, 3, 4, 5. She has no adventitious breath sounds. Everything sounds good. So now I'm going to listen to her heart. Alright. So I'm going to start with the right sternal border, second intercostal space with the aortic. Then I'm going to go to the left sternal border, to the palmatic second intercostal space. And then I'm going to go to the left sternal border, third intercostal space, Erb's point, tricuspid, left sternal border, fourth intercostal space. And then I'm going to go to the fifth intercostal space to the left, which is mid-clavicle, which is the apical/apex. And I'm going to listen for a full 1 minute. She has 72 beats per minute. Her rate and rhythm is good. I heard S1 and S2, no extra beats. Her rhythm. Alright, so I'm going to go ahead and have you stand up for me and turn around. Alright, great. So I'm going to listen to the posterior lung sounds. Alright, go ahead and take a deep breath for me. Alright, 1, 1. 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9. Alright, no adventitious breath sounds. Everything sounded good. I'm going to go to the 10th vertebrae. I'm going to have you take a deep breath in for me and out. Alright, she has even expansion bilaterally and no labored breathing with that. Alright, go ahead and turn around, sit down. Go ahead and hold out your arms for me. Alright, so they are evenly in length, symmetrical. Okay. Can you go ahead and do this for me? All the fingers to the thumb. Fine motor skills are intact. She has full fine motor skills. Hold out this arm for me. Alright, go ahead and pull towards you. Push towards me. Alright, she has a 5+ strength in her hand. Alright, so pull towards you. Push towards me. 5+ strength in her arm. I would check both of those bilaterally. Alright, go ahead and rotate your wrist. She has full range of motion with crepitus noted. The elbow. Go up and down. Full range of motion with crepitus noted. Full range of motion with crepitus noted. I would check all 3 of those bilaterally. Alright, so I'm going to go ahead and feel her radial pulse, which is in her, below her thumb. And that is a strong 2+. I would check her brachial pulse, which is on her inner arm. And that is also a strong 2+. And I would check both of those bilaterally. Alright, you can go ahead and lay down for me. So I see that there are no pulsations in her stomach. I see that it's not distended. When was your last bowel movement?
This morning.
Alright, have you had any bowel or urinary issues?
No.
Alright, any changes?
Nope.
Alright, great. So I'm going to go ahead and listen, starting with the right lower quadrant. So I'm going to find the belly button and then go out. Right upper quadrant. and then left lower quadrant. Alright, she has normal active bowel sounds. If there was absent bowel sounds, I would listen to each quadrant for 5 minutes. Alright, and then also whenever I didn't feel any, her stomach is soft, it's not firm, hard, and it's non-distended. So I'm going to go ahead and move this out of your way. Can you go ahead and rotate your hip outwards, so your leg, bring it in. Full range of motion in her hip, I would check that bilaterally. Go ahead and bend your knee, down. Full range of motion in her knee, I would check that bilaterally as well. Rotate your foot. Alright, full range of motion in her ankle, I would check that bilaterally. I'm going to go ahead and have you push up towards my hand, down. Alright, full strength in her leg, and that is a 5, and I would check that bilaterally. Alright, wash my hands. And then I also do not see any edema. Alright, so I'm going to go ahead and have you push your foot towards me. Alright, and then that way. Okay, great. So she has full strength in her foot. I would check that bilaterally, and I would note that as a 5. Alright, so I'm looking between her toes. I do not see any lesions, breakage, ulcers, any openings. Her toes don't have any fungus. I look on the bottom of her foot. No breakage, openings, sores, anything to be concerned with. No edema in her feet. I would check all that bilaterally. So I'm going to remove my gloves. Wash my hands. And now I'm going to go ahead and check her dorsalis pedis. And I would go down from the big toe, where the bridge is. Palpate lightly, and I feel a 2+. And then I'm going to check on the inside of her ankle. If it's hard to see, you should be able to see that. So the inside of her ankle, I'm going to check for the posterior tibial.
Can you tell me how many fingers?
All right, and that is all 2.
All right. I'm going to go ahead and look in your eyes. So I see that your sclera is white. You have no redness in your conjunctiva of your eyes. Do you have any drainage ever?
No.
Okay. I'm going to go ahead and check your pupils. And so just look straight ahead. And real quick, I'm just making sure that your pupils are reactive. So they're about 3 millimeters and reactive to light. Perfect. All right. What I also would like to do is check your some cranial nerve, and how I do this, one of the ways is by having you follow this. So if you could follow the tip of the flashlight, and there you go, just with your eyes. Great. All right, perfect. Very good. And so I'm going to go ahead and just feel around your head. Any head lumps? Do you get headaches?
No.
Do you have any sinus pain or pressure?
No.
Okay, so I'm just feeling your sinuses. That doesn't hurt when I push here?
No.
Okay. How about your nose? Any nasal stuffiness?
No.
Okay, I'm just going to kind of look up your nose here. Maybe that's the flashlight. Okay. And, can you open your mouth for me and stick your tongue out? Okay, and say ah. All right, so I see your tonsils there, but they're not reddened. And do you have any cavities or anything that you know of? Can I just say, let me look at your gums and just, oh, perfect. Can you stick your tongue out and move it side to side? Okay, awesome. And your mucous membranes are very moist, so that lets me know that you're drinking enough fluids. And so you have no dryness there, and your skin looks clean and dry too. Okay. Have you lost your sense of taste or smell recently? No. Okay, good. All right, and the other thing I want you to do is smile. Okay, and so your smile is equal. I'm going to have you push against my hand here with your head. Good. And now the other side. Perfect. Okay, now I want you to shrug your shoulders. Okay, very good. Okay. And so what I want to do now is go ahead and I'm going to have you sit up, and I can help you with that. All right. And so what I want to do is kind of just take a look at your back and your skin, see if I see any skin lesions or anything. I'm going to go ahead and listen to your lungs. And so there's a few things I need to do first. I want you to go ahead and squeeze my fingers as hard as you can. Perfect. Okay, hold your arms out in front of you. Okay, and then push against. Perfect. Okay, close down. All right, and so can you raise your foot against my hand? Great, and the other one. Perfect. Okay. All right, so I'm just going to look at your chest here. So when you breathe, it looks like you have an equal expansion of your lungs. You're not using any accessory muscles or having a hard time breathing at all, so that's great. I'm going to go ahead and listen to your lung sounds. And so I do this with the flattest, largest part, because that can hear higher pitched noises. So go ahead and take a deep breath. Good. And again. Okay, and again. And again. I'm going to go ahead and listen in your back too. Okay, deep breath. And again. And again. Okay, so there's 3 spots on either side of your back that I listen to, and 2 spots in the front. Okay, so you don't have any cough or anything, or do you have a cough? No, okay. You don't have any wheezes or crackles. Your lungs are perfectly clear. I'm going to go ahead now and listen to your heart. So I want to look at your neck at this point. Go ahead and swallow for me. And I want to feel for lungs. Go ahead and open and close your jaw. Feel any clicking there when you do that? No. Okay. All right, and feel for your pulse. And good pulses on either side. And I'm going to listen to your heart. And so how I do that, I'm going to turn to the smaller part and listen to 15 seconds in each area. So we're going to listen in the 2nd to 3rd intercostal space here. Okay, and then I'm going to go to your 3rd intercostal space. Just the lower part of your sternal border here. And then your 5th, which is about your midclavicular line. Sorry if that hurts. Okay, so that's great. So I didn't hear any extra clicks or whooshes or murmurs or anything like that. Ever have any dizziness or shortness of breath?
No.
Okay. So I'm going to go ahead and look at your legs and feet here. Any swelling?
No.
Ever? Okay. And your color looks good. I don't see any bruising. No bruising here. Okay, I'm going to go ahead and feel your pulses. And so, typically, it's just right on the top of the posterior part of your foot here. Okay. And the color's good in your toes, and then again in your wrists. so that's good, less than 3 seconds here. All right, so I don't, again, see any bruising, any in your joints. Do you feel any crunching or creaking? Okay. All right, I'm going to have you go ahead and lay back down for the last part of the assessment. I'm just going to look at your belly and listen to your belly. Okay, so I'm just going to gently palpate with one hand here. If I feel any lumps or bumps. Do you have any pain?
No.
Tickling?
Yeah.
Okay, and I'm going to listen to your bowel sounds. I'm going to listen in 4 parts of your belly. I just kind of put your belly into fourths. And once you hear a bowel sound, you can move on. And you have good active bowel sounds. When was your last bowel movement?
This morning.
And was it normal for you?
Yes.
Okay. Was it soft? Are you constipated? Okay, no constipation.
No constipation.
Normal. What color?
Brown.
Okay. Do you have any pain when you pee?
No.
All right. And how often do you urinate a day? Would you say?
Every few hours.
Every few hours.
Yeah.
Do you? What color is your urine?
Light yellow.
Light yellows. Do you drink a lot of fluids?
Yes.
Okay. So that's good. No cloudiness
No.
or anything in your urine. Okay, good. And then, have you ever been pregnant?
No.
Okay. And when was your last menstrual period?
Last week.
Okay. How long does your period last?
About 6 to 7 days.
Okay. Do you have you ever been diagnosed with a sexually transmitted infection?
No.
Okay. At this point, I think, your exam is normal. I'm going to go ahead and talk to the nurse practitioner and let her know that I'm not finding anything abnormal on my assessment.
Okay.
And then hopefully we can get you discharged today. Okay? All right. Thank you.
Thank you.